Welcome to our next voyage on T-10, the show with 10-minute takes on the future of education in healthcare. I'm your host, Tim Fitzpatrick. On today's voyage, you'll hear from Briscione, a well-known and highly respected expert on social determinants of health, having spent time in leadership at Anthem and CVS Aetna. Outside of his consulting work, RJ also recently announced he's joining the team at Next Ventures, an early-stage fund that focuses on human and health optimization and is led by Lance Armstrong and former Nike marketing exec Melanie Strong. RJ and I cover a lot of ground on this one when it comes to social determinants, from food, housing, and transportation needs to how having more data isn't necessarily enough to improve social programs in that last mile of delivery. But I think my favorite part of this one is how RJ highlights examples of earlier stage companies who are getting it right and how large organizations are thinking about building, buying, and partnering with those startups to raise awareness and improve lives. We are ready to go. Please enjoy my conversation with RJ Briscione. Welcome to the show. It's so good to have you. I want to kick things off with social determinants of health. I know it's an area that you've been very actively involved in, a leader in the field, but also you've been active as an investor, as an advisor to early stage companies. It seems as though I want to start with the social determinant side. I want to get an update, lay the land, kind of what is it and why is it important from someone who's been dealing in this field for quite a while.
Yeah, thanks. So I think there's an official definition that I may not get right of. First of all, thanks for having me on the show, Tim, before I jump in. Longtime fan, glad to be here. So social determinants of health, I think the official definition is something to the effect of the conditions or in the environments where people are born, live, work, play, worship, age, which is an important one, that affect a range of your health, your functioning, your quality of life, outcomes, and risks, right? And so people typically think of the first ones that anybody thinks of off the bat, and the ones that have had the most, I think, action are food, housing, and transportation. But we've also thought about, especially my previous and some of my current work, we think a lot about access. So access to healthcare, access. So when you think about rural versus urban, and then also something that's come up a lot recently is digital access, right? So in the world you're in and a lot of the world that I play in as well, there's a lot of digital health, and does that digital health reach everyone? And so why is it important? As I think folks know, I formerly worked for Aetna, which then became part of CVS, and I really got enthralled in this from our former CEO, Mark Bertolini, who really kind of popularized, at least for me, I'm sure there are lots of other people talking about it as I jumped into the world, that 80%, kind of a, well, let's cut that piece if we can, sorry. So 80% of what affects your life doesn't happen in a doctor's office or a hospital or any kind of clinical setting. There's some really fun stats about the time you spend in a clinical setting, and the time you spend in doing everything else in the rest of your life. And why wouldn't we, as people who want to affect health outcomes, pay attention to those? And so in my work at Aetna and CVS, we've done a good amount of work on trying to address all of these social determinants, hopefully in an upstream manner to affect cost, quality, and outcomes.
Amazing. I love that stat. That obviously jumps out. It's very striking about how much time we're not spending in those clinical settings. And I can see how that's, a clear sign towards where those opportunities are. You talk about food, housing, and transportation. Those are great options. And those are areas where I know I've been noticing more and more conversation, more investment, more partnerships and press. I'd love to hear you talk maybe a bit more about some of those approaches you've seen in either of those three categories or more broadly in social determinants. But if you could give us some examples of wins you've seen or approaches you've seen that are interesting.
Yeah. So the first thing, actually, I'll go back. In my work at Aetna, one of the first things I was doing was operationalizing and onboarding Unite Us, which is a fantastic company that creates networks of for social referrals, much like we have networks of doctors, hospitals, specialists, everybody that we're kind of used to in the old school medical world. Unite Us creates a platform for social referrals. So in our instance, we would have Aetna care managers and lots of other insurers have jumped on this as well as health systems and hospitals, right? And so can you create this, a very important word in there is closed loop, a closed loop system so that our care managers can refer members who we know need access to what I'll call social health. So things like food banks or housing opportunities, or in the Northeast, especially in places like Pennsylvania, there's LIHEAP, so access to heating bill assistance, which is going to become probably especially important this winter. Things like that. Can we do that in a closed loop way so that we can create data and understand what that data means for those members? The one thing I realized as I began to do work like that on referrals in general and understanding what members need is that in the world of healthcare, as big a company and as much data as CVS and Aetna were sitting on, we didn't know and we didn't have access to the data we needed to do this well, to go truly upstream and understand a member's social needs, right? Everything we've ever done before is on, unfortunately, I'll call it downstream health, right? Like we really don't know, especially in the insurance world, what needs members have until they have a claim for the most part. And if you think about social determinants in a holistic, very upstream way, we missed the boat. We missed the chance. The best cost savings opportunities, if you think about providing things like wholesome food and permanent supportive housing, the best time to do that is before the member has an acute health episode. Obviously, for members that have co-occurring health and social needs, it's hugely important. That's where we spend the most of the time focusing. So from that need for data, I in my former role leading social determinants for it and then CVS, and to go out to the market and find that. And so I found a fantastic company in Socially Determined. Full disclosure, they're now a client of mine for consulting. But they create a risk index for social needs for members, and that's by domain. So does this member have a high food insecurity need? Do they have a high housing need? Do they have access to transportation, whether that's public or private transportation? Do they own a car? Right. So they were able to provide us with all that information. They get data built in down to these 200-meter hexagons on a map. And then when we cross that with our Medicaid roster member data, it creates an individualized profile for each member that we can then, create just about any action that we possibly could dream of on for that member, whether it's providing them, kind of upstream proactive access to any of those social needs. Now, there's a lot of work to be done to on the actuarial side of the health plan world to prove that out, that will work. I think anybody who takes a moment to sit down and think about that can understand that it should work and that it will work. There's a lot of factors that go into that. How long is the member on the plan? Are we going to be able to recoup that in later times if that member, chooses to leave or leaves for any one of a number of reasons? But those are two big ones that have been really exciting. Then I've seen some others. There's a lot of work coming up in food as medicine right now. Season made really big headlines for the amount they were funded, probably the biggest one-time funding amount for any kind of social determinant play. We were looking at work with them as I was leaving Aetna and CVS for providing food to very specific patients, actually kidney care patients. So there's a lot going on out there. That's really exciting stuff.
Yeah, that's what was top of mind. So there's obviously a lot there to unpack from Unite Us, which is a fantastic example and one I appreciate. I know their story just because they are also veteran founders in this space. I absolutely
Absolutely,
love
yeah,
what they've
Dan and
built.
Taylor are both founders are veterans and great guys. Yeah.
Yep, absolutely. To the 200-meter hexagons, the first thing that came to mind immediately is, well, the specificity and the personalization, the individualization of what you can do, because healthcare at the end of the day is local. And we hear now, it seems, people are waking up to the fact that you have to figure out, even if you can scale an effective healthcare model or care delivery system, there are going to be differences in every subpopulation and area where a lot of what you're talking about is at the individual level. So I think that's
Exactly.
very
Yeah.
encouraging to hear around, to have
Yeah.
that amount of specificity in the data to then inform eventually what does the set of healthcare services look like? How do we think about referrals? And it's going to take time, but obviously it sounds like there are wheels in motion on kind of both of those fronts, and the people who are kind of shaping the way we deliver and think about delivering healthcare are have the data and are equipped with the tools and the resources to be able to think about it.
Yeah, absolutely. I think it's not, we could spend all day talking about the data need, and it's kind of funny, right? If you sit back and think about like how much data a company like CVS is sitting on. Now, no, make no mistake, companies like CVS and all of the other insurers are interested in this to the point that they, I believe, will get there someday on their own and either, build by partner, some version of that with lots of these companies that are providing this data now, right? But it's you cannot emphasize enough to me, especially and this goes back to my favorite soapbox for all health plans or anybody wanting to interact with anybody in the health system is the majority, and especially in Medicaid and Medicare and duals, where I spent the majority of my time so far, is you can't individualize it enough, and um, you can't spend too much time on getting the outreach tuned exactly right so that it reaches that member, that patient, whoever you're going for, in a very meaningful way that lands in front of them, right? When you think about your typical Medicaid member or dual member, right, they're not, um, they're not sitting in front of a computer all day like you and I are for the most part, right?
Mm-hmm.
And time's limited, and there's lots of family issues, and they probably have other folks that are struggling with health issues too. You have to make that land in front of them in a meaningful way. And we did, I was just as guilty of this as anybody. We did so much work on the, what I'll call the back end of designing these programs that sound amazing and sound great, but the outreach misses at the very kind of last mile, like right in front of the member. It falls flat right in front of the member's face, right? So when you think about new and innovative and interesting ways to get to those members and make them aware of this, like one of the bigger issues we had with this, with providing the whole social referral platform, is that how do you get members aware of it and understanding of what that is? That's a very different opportunity coming from your healthcare company, your Medicaid health insurer. Most Medicaid members were not used to kind of hearing about those kinds of, like, you're going to give me access to food and you're going to give me access to housing referral. Like, you have to tune the message exactly right.
Mm-hmm.
And to do that, you need that individualized data.
Yeah, I love that last point is so interesting. I'd love to kind of get your take as someone who has been now across the care continuum. I would kind of describe you as having your own personal barbell approach, where you've worked with large organizations inside the organization, now working with large companies, kind of as your clients. But you've also looked at the earliest stages in the just getting started type of innovation. You're
Yeah.
describing thinking about what are the innovative approaches to get people to realize the awareness, but you're also talking about the investments that are required to help these innovations reach scale and become part of the build by partner equation.
Yeah.
I'd love to just kind of get your take on, as someone who has made a career transition, has now worked across the spectrum of sizes of companies, but all kind of with the same theme and narrative thread. What are you excited about when it comes to innovation entering and kind of starting to play and partner with with larger ecosystems, large organizations?
Yeah. No, great question. Thanks. It's been so fun. I think from a fairly early, so I spent 15 years in three different managed care organizations, right? Roughly. Don't
Mm-hmm.
quote me exactly on that number, somewhere around that time frame.
Sure.
And I think somewhat early on, this is no knock against it. Like the real innovation um, is more than likely not going to come from within. And that's not a knock against it. It's really, really hard to spool up true innovation. Like you can have an innovation arm at any one of these large companies and they can put out some really interesting stuff. But I think it's more efficient to tap into some of this talent and some of the work that's coming up now as they look at it for the broader market and be able to adapt that and bring that into some of these managed care organizations for the first time, right? And I think there's there's different degrees of willingness to bring that in and bring that on. But when you look at that example, right, like I needed that data to make that work, and the people who had it was that was a Series A stage company at the time that had that, but they had the product and the ability and the talent and the IT wherewithal to get through. Now, make no mistake, that's a really difficult proposition to say, like, hey, you gotta go through all of our security gatekeeping, all of our legal gatekeeping, all of that stuff. It's not a lot of fun. I've brought a few early stage companies through that. It's difficult on everybody, but it's worth it, right? But I think the thing I'm most excited about, to probably most directly answer your question, is now, probably 4 or 5 years into really paying attention to this world, to this venture funded early stage innovation type world. It's making its way to Medicaid and Medicare and opportunities like that. Like you look at Season, like it blew my mind what they got. And, the opportunity that then they have to create a whole new landscape for Medicaid members, especially, right? Like they're not only aimed at Medicaid, but they're pretty squarely aimed at Medicaid. I think that's super exciting. It's exciting to see things like, I did a lot of work on this on various food as medicine coalitions over the years. Instacart has now launched Instacart Health. They're a huge, they really want to do well by folks on SNAP and WIC. So I think the most exciting part is seeing these opportunities come towards the Medicare duals world. And now here's the trick. I talked with folks about this literally daily now. Which of those models, and how do you make those models venture fundable, right? And make, like that's a classic issue these days, is not everything's absolutely venture fundable, and that's okay. But those that are going for it, like, how do you? I enjoy taking the role of advising some of these companies and then working with a venture fund that's highly interested in this, to make that work and for them to see what the opportunity is in Medicaid, because there's a whole layer of Medicaid of the potential and opportunity that has not been realized yet on paying for outcomes and paying for value in Medicaid and duals, especially, that hasn't been realized and that's where the opportunity would be. And that's where some of these, not all of them, of course, would become venture fundable.
Well, it's exciting to hear, especially as someone who spends most of his days talking to kidney care stakeholders in the ecosystem, and we know metabolic health. I mean, food as medicine is such an exciting area. We're seeing more and more dietitians and social workers and some of this access to social support entering the fray, and the care models that are coming up and managing populations at a large scale. So those questions are. Often I'm in the same room where those questions are being asked, and it's a fun set of challenges to be able to talk through and say, yes, we have conviction around this is something that we think is the future of how care is delivered, and it is more personal, but it also is going to allow us to bring evidence-based services that we know are working for these reasons into people who traditionally haven't had access to them. So I share the excitement around.
Yeah, that's exactly right. That's the answer there, right? Is to In fact, I was talking with a potential investor this morning about this, and said, "Well, what's the difference in something like I'll give a good example, well theory, who I think you probably know, Tim, right?" So they said,
Yes.
"Well, what's the difference in that versus what the health plan already does?" And the difference is that like get up every day and make life better for those with autoimmune disease in that example, right?
Mm-hmm.
And to have a specific set of health nutrition, a kind of wraparound services built around that specific condition, which health plans do to varying degrees, but they may not be that they, I believe, will one day find value in opportunities like a well theory because of that, because of the expertise, and because of the ability to show, eventually they'll be able to show some serious ROI on that. Again, that whole upstream mindset of, hey, we're going to wrap around, all of those types of services that you just mentioned, nutrition, especially in that case, for these members, and improve the outcomes, right? Improve the outcomes. And one thing, like, this isn't directly to your question, but whenever I'm talking to founders and funds, one of the things that I say is don't get wrapped around. And I had this mindset while at the health plans, and many share it, but it's sometimes hard to put a finger on it. You don't have to get wrapped around ROI being a dollar number over a dollar number, right? Like ROI plans, if you can look at what has happened in the stars world recently, right? Plans are very interested in and everybody's got to sharpen their pencils a little bit to make this work. So you can eventually, I mean, it all has to go to dollars at some point, but on stars, HEDIS, quality, member satisfaction, all of those things are extremely meaningful in this world now, where when you look at what happens when you lose a star, and real big dollar figures start disappearing from top and bottom lines pretty quickly.
Mm-hmm.
All of the inputs on that from quality and things like that really matter. And so if you can make a difference, if you can point to, your product, your company making a actual difference on that quality measure, I think you have something there.
Yeah, well, I'm excited, and I love to hear the shout out to Ellen and team and
Indeed.
quality on deck community. Yep, always really
Lots of
good to
shout outs
see names
involved
like
in
that
it.
in the
Yeah.
headlines. So yeah,
Yeah.
we love to hear it. We love to see it. RJ, I want to wrap up. I want to make sure there's a
Yeah.
chance for you to share how people can connect with you offline, where they can find you, follow your work. It just as we're kind of wrapping up here, I want to make sure you have a chance to connect with folks who are interested.
Oh yeah, no, thanks. Yeah. So the my day job at the focus group is where I'd love to see anybody who's interested in this, and that's the focus group
Perfect.
solutions, and we're now part of HMA, which is also super exciting for the depth and breadth of talent we're able to bring to that, and tackle big problems and talk Medicaid and Medicare especially, but kind of across the payer landscape. And then I try to be active on LinkedIn. For the most part, I'm there pretty much every day. So my name is pretty unique. If you search RJ Briscione or something
Mm-hmm.
close to that, I think you find it on LinkedIn. I'm in and out on Twitter. We'll see what happens with Twitter, but I think I'm like RJ_Briss on Twitter. I think that's close to it. I do have some fun there. Just be prepared for a wide range of topics. Everything from I go heavy on the sports. Especially on Twitter. So, yeah.
Yeah, well, I appreciate it. I've been known to follow, and it's true. I enjoy the breadth and depth of Twitter and LinkedIn. So we'll make sure that
Yeah.
your socials are in the show notes. It's all here. Everything we talked about will be in the show notes. RJ, really good to see you, and I appreciate you coming on T-10.
Awesome, Tim. Thanks.